So we're joining just to get a chance to think about what the insights might be from the recent survey that we did in sort of the GLD-IPOR COVID-19 survey. I want to start with just a sense of the game plan, and then we'll launch into the more important findings. So basically today there's four of us who are joining everybody, and one is Dr. Boniface Dulani, who with me he's the director of IPOR, and he and I and our teams have put together the survey that we'll be talking about those results. And then we're very pleased that Dr. Henry Chingaipe is the director of the Institute for Policy Research and Social Empowerment, as well as Dr. Wezi Msisha, who is a public health specialist, will be joining us with some comments. So we're going to start simply by Bonnie will present some of the main findings, and then we'll have some discussant remarks, and then plenty of time for participants to join in and to ask questions and to do so electronically. But the survey was fielded May 5th to June 2nd of this year. We had 4,641 respondents, and they were predominantly coming from two surveys that we'd fielded previously, the 2016 and the 2019 Local Governance Performance Index surveys that IPOR and GLD had fielded, and that really look at kind of community level governance questions. We'd collected phone numbers from those respondents that we were then able to do a phone survey, which we'll continue doing as we move forward. Again, this is a GLD and IPOR, but it's funded by the Swedish Research Council and Formas of Sweden. So we're grateful both to our funders, but also to the for the work that they've done. So with that, I'm going to turn it into thinking just a few minutes about the context between what's changed between the time that we provided the survey and that we are looking at now. Obviously, the first sort of change in the context has been a rise in the COVID-19 cases. In May 5th, when we began the survey, there were about 41 reported cases and only 3 deaths in Malawi. By June 2nd, when we finalized the survey, at least the fielding of it, we had 358 cases and 4 deaths. And then by today, we are about 18 cases, and about 19 have passed away because of COVID-related symptoms. Again, these are reported figures. Again, another sort of major change has been the Malawi's, I think, unprecedented elections, and then the passing of the presidency to Lazarus Chakwera. And he was recognized, I think, importantly, the expanding challenge that Malawi is facing. So he recently said, we're in a worse situation than we were 3 months ago. The coronavirus is spreading everywhere in Malawi, and it's spreading with the power to kill. So obviously a very important situation and dire situation, but also a very important time to take stock and think about what are the possibilities for the new administration as it comes into governing. So now with that, I'm going to turn it over to Bonnie, and he can give us more of the details of the results.
Thank you, Ellen, and thank you to all those people who have joined us this afternoon as we take you through some of the key findings from this first ever GLD-IPOR survey on COVID-19. Perhaps, Ellen, we could also have added that it is our plan to continue this survey in the coming months, funds, of course, permitting. One of the first things that we tried to capture in this study is to look at the extent with which Malawians really fear being infected of COVID-19. I'd like you to draw, I think, people's attention, especially to the yellow bars that are capturing, I think, the proportion of respondents that said they're not worried at all about COVID-19. It is interesting that the age category that is perhaps most vulnerable to the worst case forms of COVID-19, namely those above the age of 56, say that they are the least worried about COVID-19. And then the highest fear rates among the younger generation, those aged between 18 and 35, and also those aged between 36 and 55. But generally speaking, it's, I think, a mix here in terms of the extent to which Malawians at least feared COVID-19 at the time when the survey was conducted way back in May and in early June. And it would be interesting to see whether these levels of fear have changed, especially as the number of cases have continued to grow. I think one of the key messages, I think, that we were also finding from this survey, and something that we shared and widely at the beginning of this study, was the extent to which Malawians fear COVID-19 and the effects it has on their lives. Majorities of Malawians, really about 8 in 10 Malawians, say that they fear that they might go hungry because of COVID-19. And especially this is more pronounced in the southern region of the country, as well as among the southern region of the country. This is perhaps not surprising, because in other surveys that we've also done as IPOR, we see that Malawians tend to prioritize hunger as their most important problem that they want the government to be addressing. It's not surprisingly, I think a lot of people fear that COVID-19 will worsen their hunger situation. Of course, Malawians that identify as outsiders in their communities express more fear of hunger because of COVID-19 than those that are much more localized. In terms of the impact of COVID-19 solo on healthcare, 60% of Malawians say that they fear that accessing healthcare will be more difficult due to COVID-19, especially as health services take on more COVID-19 cases. And this is more pronounced in the northern part of the country, in the border districts of Chitipa, Karonga, as well as in Kasungu in the central region, and less so in the south, although again, as the number of cases has grown, especially in the southern part of the country, it's more likely that these numbers might have grown across the board. But generally speaking, there is this sense that COVID-19 will impose a greater stress on the country's health services. There is also, I think, one issue related to COVID-19 is the sense that there is stigma attached to COVID-19 cases. And not surprisingly, 76% of Malawians, but 3/4, say that the other people will think badly of them if they have COVID-19. We've seen in recent days, of course, some prominent personalities in our communities coming out to declare that they've been found with COVID-19, and encouraging others, including members of parliament, to actually come out to go and get tested, and then especially also to encourage people that have been in contact with them to come out to go and get tested. So hopefully the sense of the fear of stigma attached to COVID-19 will reduce over time as the number of cases go up. Of course, this is also similar, I think, to the situation at the beginning of HIV, the HIV epidemic as well, that there was that stigma attached to HIV/AIDS. Now we talk about quarantine and the other ways of preventing COVID-19. But we see also one of the areas that we sought to test in this survey is to look at what are the options that people have for quarantine, and what are the kind of vulnerabilities that they experience at home. A lot of Malawians live in multi-generational households where you have people who are young and as well as old. And again, this is not surprising, given that there is no provision here of all the people's homes in Malawi. So this does put people very, very vulnerable situations, especially as there are multiple generations living in the same households. A lot of Malawians also live in households with two people, more than two people per room, which also does make, again, the option of quarantine within the home somewhat problematic. And we also see that a lot of people also are living in households with people that have some people that have pre-existing conditions, including diabetes, high blood pressure, lung disease, or other health problems. So again, this does again expose people with the pre-existing conditions related to catching COVID-19, especially where we are promoting in-house quarantine. So perhaps government, the new administration, should also seriously consider the option of quarantine in institutional facilities rather than relying on individuals to quarantine at home. We also know that there has been a promotion of hand washing in the household, also the workplace, and the other facilities. But while a lot of people have access to water to wash their hands, a lot of people, so about 95%, say that they have, of Malawians say that they have access to enough water for their entire family to use for washing hands. But that said, about a quarter of Malawians report not having access to soap or sanitizer to wash their hands. So again, as government, the new administration seeks to promote hand washing with soap. Perhaps I think the emphasis should go towards assisting Malawians with soap as well as hand sanitizer. And the need for soap in particular is much more pronounced in the southern and the central regions, in the central regions and the northern region. But again, not surprisingly, again, lack of soap is also associated with the insufficient income. So government, I think, should do its best to try and assist households, especially those that have low income households, so that they can wash their hands. One of the challenges that the country faces in terms of COVID-19 is the extent to which people are willing to report to go get tested when they show symptoms of COVID-19. Again, at the time of the survey, we noticed that some of the border districts like Karonga, Mchinji, and Mangochi had the highest percentages of self-reported cases of at least symptoms of COVID-19. And then Mchinji and Mangochi also had the sad part, the challenge perhaps is that 30% of people in Mchinji and Mangochi also reported to have gone without soap to wash their hands. So on one hand, the people in these districts have report having the symptoms of COVID-19, but unfortunately at the same time, they face challenges in terms of accessing soap to wash their hands. So I feel I have lost the slides, so I hope people can still hear me. I will continue to speak.
Yes, I will get a hold of Ellen.
Okay. Now, in terms of the economic impact of COVID-19, majority of Malawians report experiencing reduction in income, and this really applies across the country. Of course, there is variation, as one would expect, by district, with districts like Karonga, again, reporting, about 1/3 of the residents of Karonga reporting a decline in income, but in the southern border district of Nsanje, as high as many as 82% of the people there report a reduction in income as a result of COVID-19. In the northern region, generally speaking, we see, when we compare by region, the northern region citizens there report, I think, lowest reductions in income compared to the center and the south. And again, this is perhaps, again, for those who are familiar with Malawi, not perhaps entirely surprising, given that the levels of poverty tend to be highest in the south and in the central parts of the country. We also looked at, in terms of the economic impact, apart from income, we also looked at whether people had lost jobs as a result of COVID-19. So while Malawians see really a loss of income, only 16% report having lost a job or were reported working fewer hours as a result of COVID-19. Again, I think this might be a reflection of the fact that majorities of Malawians are perhaps in informal employment, or either in businesses and run businesses. So they're not necessarily losing jobs per se, because they might be losing business opportunities and other income earning opportunities. But again, this is also at the beginning of COVID-19, and it will be interesting to see whether this has changed as time has passed, because as we know, government civil servants, for example, have been working reduced work hours and have also been encouraged to work from home. Now, as people are facing these twin challenges of losing income on one hand and then losing job opportunities at the same time, we're also interested to find out what the impact of COVID-19 is. And I think this is, again, another area that the new administration should be looking at. We find that there are more Malawians that say they need now assistance because of COVID-19. And I think this also speaks to the failed attempt way back in May, when the previous administration tried to impose a lockdown on the country, and a lot of people protested, not necessarily because they did not see the value of a lockdown, but they said that that should have been accompanied by support to citizens to mitigate the impact of a lockdown. But as we can see from our findings, there are more Malawians that say they need assistance, but they are not getting that assistance. And this is much more pronounced, in the southern region, as well as in the northern region, the northern districts of Karonga, and other places like Mulanje and Zomba, for example, that have had, even by the time of the survey, we are already experiencing numerous cases of COVID-19. So the new government, really the new administration of President Chakwera, needs to look at this area in terms of how the government can help to mitigate the economic effects of COVID-19. Indeed, not surprisingly, a lot of people also do fear about the future economic impact of COVID-19 on their lives. A lot of people, again, across the whole country, but much more pronounced in the central and in the southern region, say that they fear a reduction in future income or indeed salaries due to COVID-19. And the others fear that they will go hungry because of COVID-19 in future. Again, these are little challenges that people really fear about COVID-19. So although we get the sense that sometimes that Malawians without a lockdown might appear as to not be taking COVID-19 seriously, I think there are genuine fears from most citizens, in the country, but more pronounced, as already said, in the central and the southern region, about the fears of going without income as well as hunger. Now, are people taking precautions? And what will they do if they have symptoms of COVID-19? This has, I think, important implications in terms of civic education and also requiring people to change our behavior in light of COVID-19. About just two-thirds say that they would stay away, they would not stay away from public gatherings if they had COVID. About a third, sorry, apologies. About a third say that they will still continue to attend public gatherings even if they have COVID-19. So we see only two-thirds, about 63%, saying that they would stay away from public gatherings if they have COVID-19 symptoms. The willingness to avoid public gatherings is highest in the northern districts of Chitipa and Karonga, as well as in Nchewu and in Sanje. But in the other districts, there is maybe kind of a lackadaisical approach, and that people would still attend the public gatherings. So this also calls for maybe the government to intensify the need to use, face masks, for example, because a lot of people from these surveys are showing that they will still attend public gatherings even when they have symptoms of COVID-19. So we take a closer look at Mangochi district, for example. Despite the Mangochi having high levels of self-reported symptoms, and as we already pointed out, lacking access to soap for frequent hand wash, just about only half of Malawians, the citizens based in Mangochi, say they are willing to avoid public gatherings when sick. So again, COVID-19 really challenges us to change our behavior and including public gatherings such as church gatherings, attending religious gatherings at mosques, funerals and other types of gatherings. And yet we see, as many as 50% of citizens in Mangochi saying that COVID-19 will not really change, will not make them change their behavior. Then we also look at where people are getting their help. Most Malawians are relying on their families for help. So about half say that they are looking at their families really as a source of getting help and assistance during these times of COVID-19. Others relying on neighbors, others looking at the village head and religious leaders as the sources of help. Very quite substantial proportions of citizens in the country as well tell us that they are basically, they don't have anyone to go to for help. And this is much more pronounced again in Mangochi, in Mulanje again, in Nchewu, in Ndedza, in Kasungu, as well as in Sanje district in the southern region. But again, it's interesting here that government is not seen as the primary source of assistance during COVID-19. As we pointed out at the beginning, as a way of closing, we are also interested in continuing to collect more data on COVID-19. So we will be undertaking and be fielding a second round of GLD-IPOR COVID-19 survey and to get, I think, people's view and also to see if people's behaviors are changing, and especially now as the number of cases continue to increase. So we do provide there a web link for our page for the COVID-19 project. It's https://GLD.gu.se, and then you can take the link from there. People can also and encouraged to sign up for project updates at the web page that is provided on the screen there. Let me stop here and then Ellen, maybe you can take it up from me. Thank you.
Thank you, Bonnie. And apologies that my internet decided not to work halfway through there, but thank you all for putting up with that. I think we're going to start with Henry's responses or remarks in regards, and then go to Wezi's. Is that correct?
Yes.
Great.
Okay, great. I am trying to put on the video. Okay. Thank you very much, Boniface, for walking. I must say, one would be tempted to speak to nearly everything and to provide either alternative explanations or other things to consider. But I want to limit myself to 3 of the themes that you have highlighted in your findings. I want to speak to the theme on vulnerabilities. I also want to speak a little bit to the theme on fears and to the theme on trust in authorities. Hopefully, because those are within the areas of my technical competence, so I don't misinform people or I don't mislead people. I think in terms of vulnerabilities, what that data is telling us, at least from a policy perspective, is the precarious nature of our social protection system. I think that as a country, we really need to up the game on social policy, social security systems, and make sure that we have a social protection system that works for the different categories of the poor, so that we are responding in times of emergencies like these to the vulnerabilities that people actually have. I was particularly interested when you made the point, I think 2 points. One is about the difficulty people have accessing soap and sanitizer. And when you look at the prices of soap and sanitizer, the basic soap, the basic sanitizer, the prices are not that high, but what it tells us is that we have a large part of our population living on hand to mouth and surviving on very, very, minimal amounts of resources. And that points to the need of social protection systems that can, actually just help people to do the minimum to live a life of dignity. And I think we need to have a very serious conversation about social protection and social security systems in this country. That is one thing that the COVID-19 pandemic actually bringing and highlighting, so that the new administration, as you call it, can actually begin to pay attention to social protection. As you know, Boniface, a lot of our social protection programs are targeted. They only reach out to very few Malawians, less than about 10%, or at most 15% of the poorest of the poor. So it is very, very, very low. And when an emergency like COVID hits, it hits everyone. So it hits all the 52% of the poor, for instance, and they can't afford. So it means that we need to be focused on those things. The very same thing I think about social protection relates to the point you made in the findings about government not being seen as a primary source of help. It's because we run a social protection system that is largely informal. It is dependent on siblings, parents, those that are working within the extended family system and so on. So when a large-scale pandemic like COVID hits, even that coping mechanism that is based on extended family is stretched. It can't cope very, very well. The other thing I think that comes out, at least for me, from the vulnerabilities theme, is the whole issue of housing poverty, and connect that to housing policy. Multi-generational households in which you can't have less than 2 people, sometimes per room. And if you look at the houses, they are not big houses, So the rooms are already too small, and so on and so forth. And I think we have had a very robust policy discourse in this country about housing policy, except for a few isolated, sometimes politically engineered projects on housing. Even the selection criteria of who gets to have a house built by government in that sense is so because the projects come within that big framework of patronage politics, and it doesn't really address seriously from a policy point of view the question of housing poverty in the country and housing policy issues. But I think that it is very, very obvious. Driving across the country, east to west or north to south, the most immediate thing that indicates poverty to you are the types of houses people actually live in. Most of them mud houses, grass thatched, very small, poor ventilation, and so on. And I think COVID-19, given its epidemiology, is telling us that we really need to have a conversation about housing. On fears, similarly about food and nutrition security. We have the policy, the food security policy, the nutrition policy, but you see over 80% of people were afraid that they would go hungry. And that leaves just 17% of people that were not afraid of going hungry as anti-COVID measures would be implemented. And that means that a lot of people are doing hand to mouth. So they find their food on that day and they eat it on that day. And that means that you can't do things like lockdown for 80% of the people when you have a very precarious social system that cannot deliver food rations. And I think that we need to be focusing on food and nutrition security beyond, just the provision of assistance for people to produce their own food. We need to widen the discourse, I think, on food and nutrition security. The other thing I think that comes out from the fears is the issue of urban poverty. Because while in many countries people talk of urban bias in terms of development, I think here we have a rural bias in terms of addressing poverty. A lot of government initiatives, government policy and programs focus on rural poverty because 80% of the population lives in the rural area. But the majority of those that live in the urban areas are poor. In fact, some of them are poorer than those in the rural areas. But we have very little discussion about urban poverty and how to address it. I recall that as part of the response measures to COVID-19, government announced an urban social cash transfer, but it has not been implemented, and now we hear stories that actually the money that was earmarked for that is no longer available, or it has been spent, or it has been diverted, and so on. So I think we need to be focusing on the urban poverty as well, rather than going with the perception that those that are in urban areas are well off and therefore do not have very serious income problems. I think we must point out that the resistance to the lockdown was basically by the urban majority that are in the informal sector and that do hand-to-mouth sort of living. And I think it brings out this issue that as a matter of policy, we need to be responding and looking at the urban poverty. Lastly, I want to speak to trust in authorities. I think that what is lacking in the presentation of your findings, Boniface, is an emphasis or a highlight on the fresh presidential election as a context in which we were responding to COVID, because in my view, a lot of what should have been done to address COVID was actually not done, or it was badly done because of what people read in the context. An important issue is that the politicians, particularly those in the government at the time, wanted, or at least gave us the impression that they wanted to use a response to COVID-19 as an excuse for avoiding the fresh presidential election following the nullification of the presidential election in 2018. And that raised a lot of questions. And I think it still does have an impact in terms of the legitimacy of the government. So that was a government that was widely seen as illegitimate, and the solution to that illegitimacy was doing the election. Yet, anti-COVID measures required that we can't do an election in the way we have always done. And I think that's why, for me, I find that a lot more people, over 80%, feared, did not mind about COVID, and they were happy to go on. Maybe with the election, they feared the other things more than the COVID-19. So I think we have to factor in the question of legitimacy. Since the new government came in, you can also begin to see a change in the public mood in responding to anti-COVID measures. And I think it speaks to their perception about a legitimate government that is introducing measures in the interest of public health. At that time, the government was seen as using COVID to actually suppress freedoms and to actually avoid an election that would have given it the necessary legitimacy to actually implement the kind of measures that a response to COVID-19 requires. And also the whole question about inclusivity in the response mechanism. You will recall that there was a cabinet committee that was mutated into a presidential task force and so on. So a little bit of trial and error, but it was initially exclusionary. And we saw in other countries that governments that were successful at bringing out a very useful and effective response to COVID-19 was when they could do the bridges across the political divide and come out as a political leadership across the political divide to actually enforce these measures and announce them together and so on, so that people see that they are not just clamping down on people's freedoms and limiting their liberties in that way. So I think that what we are learning from here is that although governments will lead in responding, it is important that the political leaders across the political divide come together to provide required national leadership to provide a useful public policy response to emergencies such as COVID-19. And I think that in the case of Malawi, and this will be my last point, one thing I think that reinforced people's attitudes to undermine government-announced measures to COVID-19 was the whole focus, on resources, because from the cabinet committee to the presidential task force, I think that there was a lot of talk about money. Presidential election, perhaps money was being misused. There were indications of corruption as well as rent-seeking practices. And so therefore creating the impression that the COVID-19 was not just a way of avoiding the first presidential election, but it had also become some kind of a cash cow for those that were actually at the core of providing the response. Ellen?
Thank you, Henry. So I'm going to move quickly to Wezi so we make sure that we have some time, and also remind participants that if you want to ask any questions, to put them in the Q&A. They can be for any of Bonnie, Wezi, or Henry. So Wezi, thank you for joining us.
Sure. Thank you, Ellen, and thanks for the opportunity to join this discussion on the findings of the COVID research. I will focus my comments around 3 areas that are related to the public health findings from the research. I am aware, of course, that the government and other public health actors in Malawi have been taking action already on some of these areas. So this is not to say that nothing is being done, but more just to emphasize certain key issues. So my first set of comments will relate to the issue of Malawians' fears around COVID-19. As Bonnie highlighted earlier, the finding that the majority of Malawians who were surveyed, and especially the elderly, were not worried about contracting COVID-19 is of particular concern. And I think it would be interesting to know whether this attitude has evolved or is evolving, given the growing number of people who now have COVID-19 in Malawi. I think good coordinated communication with consistent messaging is key in this aspect. It's important that the public is well informed on the COVID-19 risks, and that it should be understood that everyone is at risk of contracting COVID, and that the elderly, more especially, and people with existing health conditions, high blood pressure, diabetes, and other conditions affecting the immune system are at a greater risk. I think the president's message around this issue of COVID-19 risk was right on point. He spoke a few days ago, and I think these are the type of messages that need to be repeated and sustained over time so that people really get to know that this is an issue that can potentially affect everybody. I think what is also key is ensuring that people have the correct information, while also taking care that as the information is being given out, it is not unnecessarily stoking their fears, so that people do know that there are clear actions that they can take to protect themselves. And I also want to touch upon the issue around people's fears of being stigmatized if they're found to have contracted COVID. I think what's important here is, and what can make a difference, is how the information and news is transmitted through various media channels. And by this I mean the information and news around COVID. How is it transmitted to people? First of all, I think the key to addressing stigma is to ensure that information is factual. So it's based on facts, it's not rumors, it's not myths that are floating out there. And also important is to ensure that any negative language that there's not negative language used to describe COVID or the people who have it. And if there is such language used, that it is promptly corrected, and that people do speak out against these negative kind of behaviors and statements, including those that may be transmitted through social media. And I think also important is to highlight the fact that there is no shame in contracting COVID. It can really happen to anybody, but that the majority of people who do contract COVID in other places around the world do recover. And so it's not necessarily a death sentence. This brings me then to the next set of findings around the response to COVID-19 illness, where, as Bonnie highlighted earlier, that it's quite notable that 37% of people said they would not stay away from public gatherings if they had COVID-19 symptoms. I think, again, it's important that everybody realizes that COVID is a real disease, and I think maybe more and more people are starting to see that it is, as it's now in the midst of everybody in Malawi. And therefore, it's everyone's responsibility to take actions that will minimize its spread. I mean, I think beating COVID will require the sustained implementation of a combination of prevention approaches. So wearing a mask alone, while it's an important thing to do, is not enough. So I think it's really critical that the government continues the public health messages that have already been put out there in all the languages, to make sure that everybody does get the information that they need to know. First of all, on the basics of how COVID is transmission, and then linking to that to why the different precautionary measures that are outlined should be followed by everybody. I think it's also important that multiple platforms should be used in transmitting messages. So, for example, the government could work more closely with mobile phone companies in sending out daily or maybe every few days different messages around COVID, so that people do get a frequent reminder on the things that they need to be doing. And also important to make sure that the information is targeted towards different segments of the population. For instance, there was the concern from people living in the border districts that they were more worried about COVID. So I think making sure that different people are getting information that resonates with them is also critical. And I think equally important is that the messages should focus on the practical things that people can do to protect themselves as they go about their daily lives. Because I think, as we can rightly all see from the trend around the world, COVID-19, I think, is here to stay with us for some time. And therefore, as Henry also noted, that the likelihood of a strict lockdown in Malawi is probably highly unlikely. So people will need to know what they need to do as they go about their lives, whether it's going to the market, work, and so on. So I think really highlighting those things that people should do. So properly wearing a mask, making sure it's covering nose and mouth and not somewhere on your chin. Staying away from people who maintaining physical distance from people, because there is also the issue that there are certain people, while not exhibiting symptoms, may actually have the virus and be able to spread it to others. So I think enforcing that issue of physical distance, staying at home if you do not need to be out of your home, I think is really important, as well as also the hygiene habits around coughing and sneezing and so on. And I think also, as the COVID cases are now rising daily, I think it's also critical that the government engages with the private sector and other actors in that sphere to ensure that COVID precautions are being enforced in certain high traffic areas. So, for example, making sure that there is universal use of masks, availability of hand washing facilities, hand sanitizers in shopping areas, shops, banks, and these kinds of locations. And making sure, for example, that if you're not wearing a mask, maybe you're not allowed entry to certain places. I mean, of course, there are certain implications about, around masks, as we heard earlier. And I think also making sure that certain surfaces in shops and other areas are disinfected frequently. I think there's also an issue that I saw highlighted in a newspaper article today in The Nation, the issue of funerals. I think there are certain events that can be considered super spreading events, where there are larger numbers of people in crowded conditions in close proximity. I think there should be some consideration to putting in some strict measures, restricting the numbers of people who can attend those kinds of events. I know that it's a difficult issue culturally, but I think if people get to understand that it's either a matter of their own life, and contracting this disease or not, I think these are things that could be done. I think similarly, I think information also needs to be shared with people on what they can do if they do come in contact with someone who has COVID, or if they do develop symptoms of COVID at home. What are the actions that they can take to protect themselves or to deal with the situation at home? And I think as highlighted earlier already, that issue of that not everyone has access to soap for hand washing or hand sanitizer. I think this is critical. This then raises the question of what is it the government can do to respond to this challenge, because it's going to be a challenge, as frequent hand washing is a key precautionary measure in this COVID challenge. So the question is, does it mean they temporarily lower the price of soap? Do they remove taxes on soap? Do they give out soap and face masks for free, for example? So I think it would be interesting also to hear a little bit from others and those who are connected to the meeting, their thoughts around this issue. My final set of comments relate to the actions that the government can take to ensure that people have continued access to health services. I think, as Bonnie noted, 60% of people surveyed were worried that COVID-19 would make it harder to access health services. And I think it's true that there does need to, particular attention does need to be paid to this area to ensure that core health services continue to be provided, while also ensuring that health facilities are able to adequately cope with the pressures of treating COVID patients. So I think it's important that those key services such as immunizations, family planning services, HIV/TB services continue to be provided. I think several of these services do rely on community-based platforms using community-based workers. I think the situation with COVID will necessitate rethinking how some of the services are delivered. For instance, where it is possible in certain settings, perhaps reinforcing the use of appointment systems to avoid overcrowding of people in clinics and health facilities, where possible, doing mobile phone consultations for uncomplicated cases where somebody does not need to physically travel to a facility, for instance, making sure where possible that people have certain medications and supplies on hand for several months so that they don't need to keep going back and forth to health facilities, because there is a risk also for transmission, through using public transportation, as well as being, in contact with others at the facilities. And I think all of this does hinge also on ensuring the safety of those who deliver those services, the health workers, as well as the patients themselves. So I think ensuring that the health workers are well trained on COVID risk mitigation measures as they're delivering care and services in the different settings, and also ensuring that they have access to adequate and appropriate personal protective equipment as they carry out their functions, as well as hand washing facilities, and that there are proper sanitary procedures put in place and being used at all times in health facilities. I think this is very important. And I think finally also, while maybe something that's more a little bit long-term in nature, but I think there are things that could be done to sort of bolster the existing health infrastructure to help cope with the COVID situation. So I think, for example, I think there may be different development partners who could support the government in some of these. So enhancing the screening facilities at ports of entry into the country, making sure that the that the quarantine facilities that are being set up are adequate, so that people who are there do not have to run away, as we heard reported in the media a few weeks ago. So making sure that the places are safe, there are adequate hygiene facilities, the food is provided, and that there's adequate isolation. And I think also looking at the possibility of erecting temporary structures at hospitals or health centers to provide additional bed space if needed to accommodate COVID patients. So I think these are some of the things that the government needs to think about and work together with other partners and actors to put into place. So I will stop here. Thank you very much for your attention.
Thank you, Wezi. Thank you very much. So I'm going to try to stop sharing my screen. I'm slightly challenged, as you can tell, with this, but we're getting there. And we have a few questions have come in, and I also want to open it up. I find it personally, I'll take a sort of a bit of a moderator's prerogative. I find it really interesting that we have almost two sets of issues that we need to consider. One are kind of long-term issues. Henry, you spoke a lot about things like housing infrastructure and social protection, and some of the kind of, in Wezi you ended there with some of the kind of longer term health infrastructure issues, and others are these very kind of key immediate issues. So it's a time when we think about both of those sets of issues being on the table at the same time. So let me again turn it over to sort of questions that we have. I can figure out how to do that. There we go. Yeah, so we have I think a number of questions. Well, first of all, actually, maybe I'm sorry, I should have done this first. Ask Bon if you have anything that you wanted to respond to, or any issues that you wanted to highlight that Henry and Wezi have raised.
Now, I was really taking copious notes there. I think looking at some of the important issues that both Henry and I think Wezi highlighted. I don't want to really, just repeat everything that they said. I think it was clear enough, and I was touched. I think the point that Henry made about housing in Malawi, and how I think this now becomes a major issue in the face of a pandemic that does require more space, like COVID-19. I think it does challenge our governments to take a more holistic approach to resolving some of the poverty challenges that we face as a country. And also this issue of the resistance to a lockdown, which Henry described as, I think, mostly by the urban poor who live, I think, basically from hand to mouth. I think for a long time in Malawi, we've tended to highlight poverty as a rural phenomenon. But increasingly, I think we are seeing this challenge of urban poverty. And indeed, there are people who are actually make the argument that urban poverty is now becoming a much bigger challenge, at a minimum at par with rural poverty. So again, it's times like this that you realize that addressing this kind of problems can actually have other far-reaching effects in terms of addressing health pandemics like COVID-19. I know Henry was tempted to talk about the legitimacy, government legitimacy, and how that really has impacted the fight against COVID-19. I know that in the survey, we actually had several questions in terms of the politics of COVID-19 that perhaps we didn't present in the highlights that we gave. But yes, I think a lot of Malawians did tell us that they felt that the elections should have gone ahead and shouldn't have been postponed because of COVID-19, and that even the campaigning for the elections should have continued as they did. And Henry, I think you're right that maybe partly this was a reflection of the doubts that people had for the former government really to address COVID-19, or indeed people thought that maybe COVID-19 was just an excuse to try and for the government to run away from an election for the election and avoid, I think, the elections altogether. It is unfortunate, I think, that happened because COVID-19 should not be a political issue. It is a real serious issue that as a country and indeed the new administration has, I think, a big responsibility to address and to convince the people that despite the fact that they were beneficiaries of the elections, I think now it is high time that there is renewed emphasis and focus on COVID-19. It is not going to be easy because some, I think it is fair to say, I think on the campaign trail, there were sometimes messages giving the impression that either there was no COVID-19 or that the cases were so few that Malawians shouldn't have been worried about that. But as Ellen, I think, highlighted at the very beginning, we've seen really a huge jump in the number of cases from the time we started this study with just about slightly over 40 cases to now where we have about 1,800 cases. So this is a serious issue, and I think, in all fairness, I think the president has already addressed this issue maybe 2-3 times in his last speeches to highlight, I think, the importance of the country really joining together and everyone. And I think this also speaks to what Wezi was saying, that the fight against COVID-19 is not about government fighting COVID-19 alone. All of us have to play a role in fighting COVID-19, and this does require us to change our behavior. I just wanted also to echo the point that Wezi mentioned about funerals, and I think the importance of we Malawians really changing some of our traditions. I also did attend a funeral a few days ago, and I have to say I was quite impressed with how many people were wearing face masks at the funeral. But unfortunately, a lot of us are also not using face masks the correct way. We have a tendency to put them on our chins or just to walk around with a sign that I have a face mask without using it properly is just not sufficient. The face mask is not going to protect us just because we are carrying it or we are putting it on our chin. We have to learn to use them properly, and that this is everyone's responsibility. And the government, yes, has a responsibility to lead in this process, but all of us have also to consider ourselves as the lead partners in the fight against COVID-19. Thanks, Ellen. I don't want to start all over again because I can go.
No, thank you. I'm going to sort of combine a couple of questions or what's around the edges of a couple of questions that have come in. And so, Wezi, you particularly talked about the importance of messaging, and Bonnie, you a bit have talked about also, I think, underlying this is a question of legitimacy. And Henry, you touched on this as well. And we know that in the survey, another question that we had was how much people feared that that this would become the cash cow, that it would be used for corruption. And of course, the elections themselves are quite divisive. So when we think about everything from messaging and trying to get people to believe that COVID-19 is a very serious problem, and to take seriously the kinds of either recommendations or policies that are put forth that are limiting rights, right? That try to restrict people. How can the administration convince people who may have been on the other side that this is equally important? I mean, another thing we see, by the way, in the results is that those who were sort of basically pro the former administration tend to think that they were more worried about COVID than those who had sort of favored the opposition. So, given the politics of this, how can the administration successfully put forth its case and policies and sort of be seen as legitimately messaging what needs to be done?
Thanks, Ellen. I think that's not an easy question, I think, given the context, but I think how the president has started so far in sort of being open from the beginning about the situation with COVID, I think continuing to share that kind of information, I think will help to show that the situation is real, that it's not fake. And I think also what certain high-profile figures have done by coming out and saying, I've tested positive for COVID and so on, I think these are the sorts of things that will start showing people that, okay, maybe this is not some hoax that somebody invented, just for the sake of political purposes. So I think during one of his statements a few days ago, the president had mentioned there were some questions raised around resources available for COVID and so on. And he had said he didn't have the data and would come back. I think it would be important for him to follow through on those kinds of things also, and to regularly come back and report to people what's going on, because I think that also helps to show that the government is being transparent about what they're doing and that they are following up on things that they said they'd follow up on. So I think just sort of keeping on reinforcing those messages in a variety of ways, I think will help. And then I think also people coming out and speaking out openly about their experiences with COVID also, I think is useful. And then finally, I don't know to what extent this would be feasible, as Henry, I think, had mentioned, the importance of the messaging not only coming from the government or the current party that is governing, but also the other political parties and figures also joining in and reinforcing the same kind of messaging. Now, this may be challenging given the context and recent events, but I think it will be important to make sure that those people who may be supporters of certain parties do know that, okay, this is a real thing. It's not just this government talking because maybe they're in power now. So I think these are some of my thoughts around this. Thanks.
Thank you. Thanks. Bonnie, I know that you've said you will answer a question live. Would you like to answer a question live? I think that, Wezi, that's incredibly helpful for thinking about other paths forward on the legitimacy issue. Bonnie?
Yes, sorry, I was actually answering some of the questions as well. I think the question that was requested was, I think, the case of a prominent politician from Karonga who came out, I think, publicly to disclose his COVID-19 status, and I think he's been hospitalized in a long way. And I think this really goes quite a long way, and in in reducing the stigma attached to COVID-19, but also to demonstrate that COVID-19 really can affect anyone and everyone, including high-profile individuals like Frank Menefumbo. And I know as a result of that, the state vice president also did take a COVID-19 test, including his own wife, and they came out in public to declare that they were tested negative. I think these kind of high-profile cases really help and should hopefully go a long way in assuring or reassuring many Malawians that it is okay to go get tested, and it is also, as Wezi pointed out, it's not a death sentence if you are found to have COVID-19, and that yes, despite the challenges that I know many of us fear about the quality of our health systems, but that we do have capable professionals in our hospitals that can provide excellent care, and it reassures everyone actually when high-profile public figures like Mr. Menefumbo is being treated at a public hospital rather than having to go to a private hospital. I think that should be reassuring, but of course it also encourages people who have been in contact with him to go and get tested.
Great, thank you. I might want to read out one of the questions from one of our colleagues, right, which is actually also voted up. It says that one of the issues that the Malawian courts raised in that we do not have the robust laws that would assist in anti-COVID-19 fight. So although it was mainly related to the lockdown, don't you think that it is still a priority for the current government to sort out the issue? And I think in one way this is asking about what's the role of the courts versus the government on some of these things that really do sort of restrict rights. And in the comment it says this is not for the lockdown per se, but for general controls such as the closure of drinking places, etc. So what is the role of the courts in this? I'm not sure who wants to answer that, but yeah. Bonnie, I think you're muted. Or Wezi, do you have
I wanted to thank again our good friend, Professor Kayuni, for that question. I think, he does raise a very valid point that a lot of our legislation in this country tends to be reactionary. So the point he's referencing, I think it was a court decision that he granted the injunction against the lockdown. And I think the courts really highlighted how outdated that piece of legislation is. I think it is from way back in 1967, if my memory serves me right. And the courts essentially said, look, you want us to help you with the fight against COVID-19, but the courts don't make laws, the parliament does. And if we have outdated laws that are not sufficient for fighting a pandemic like this, the onus should be on parliament. And I think this speaks, in my view, to a broader need for thorough legislative review in this country. That we tend to look at legislation in a piecemeal fashion, and we usually are reactionary. But as COVID-19 has demonstrated, maybe sometimes it's too late. We don't have enough time to go and change the legislation. So it's important for Parliament and the new administration to undertake a thorough review of not only the legislation on the public health, to be perfectly honest, but there are way too many pieces of legislation on our statute books that are so outdated and they fail to speak to the daily realities of the 21st century.
Like and I'm not sure, but do either of you have anything you want to add?
Hi. First of all, Henry just messaged that his laptop has run out of battery, so I think we may not hear from him for the rest of the session. I think I agree with what Bonnie raised that there is a need to look at some of the laws and really see whether or not they are adequate for the current day and environment where these kind of pandemics, unfortunately, are something that are likely to occur more and more. And therefore, how do those relevant laws, making sure that the relevant laws are able to adequately address and deal with those kinds of situations when they come up, I think is important. Then I think that also gives the court some kind of current and realistic framework within which they can then deal with issues that are brought to them by various parties. So I think I couldn't agree more with what Boniface has said. Thank you.
To say from an outsider's point of view, the first thing that goes through my mind is like, revising the laws or and kind of reconciling them with the current sort of state of the world, or thinking about kind of social protection and some of the kinds of the bigger issues and the ones that require state capacity is the first thing that sort of runs through my mind is, okay, where do we get the capacity to do that and fight COVID at the same time? Right. And then, I think also about the fact that, Malawi has managed to sort of in a relatively short order put on undertake an election and do it quite well, I think. So, and I realize that's a controversial statement, but, it does make us think that to some extent, these are challenges, right? And of course, they're very difficult times and difficult challenges, but there are also times when it can sort of be an engine or a motivator to do things that we might not have thought were possible, not that long ago, right? So, maybe that's a bit optimistic in a world which feels like it's very turning the other way. But there are times when you can think, okay, well, what might seem impossible might actually be, be what drives, and this may be a driving moment, actually. So. I know that we've lost Henry. Are there any other sort of last thoughts or issues that either you or anybody in the sort of audience wants to raise?
I think maybe one point that I also want to highlight, I think, as part of the behavior change that people need to take on board going forward. I think we talked about consistent use of face masks, for example. I think it's also important to recognize that there's certain hygiene protocols that must be followed around the use of face masks, because I think if not properly used and if certain protocols are not adhered to, those same face masks could also potentially become a source of infection. So I think that also needs to be made clear in the messaging. And so I think especially with reusable face masks, so making sure that they are washed and properly handled after each use, I think is important, so that people don't end up sort of infecting themselves when they actually think they're protecting themselves. So I think these are the kinds of things that also have to be emphasized. And then also I think given the current context, maybe it would be best if the reusable face masks are promoted more than the medical ones, because I think it will be critical to ensure that whatever supplies of medical masks are there are reserved for the use in health facilities and clinics and so on. And I think in several countries, I think in the region, I think they have used the production of face masks as also an income generating activity within these constrained economic times due to COVID. So I think the government could look into that and sort of make sure that there's certain, there are people who know how to properly make the face masks, and that could, become a source of income, but then also meet the demand that is clearly there for citizens in the country. Thanks.
Yeah, I just wanted to echo that. I've actually seen, different types of face masks being used, and some of them you actually fear for the people wearing them, that it's much more of a health risk to them than perhaps what we are also trying to avoid. I think while we're encouraging people to use face masks, but you're right, Wezi, that we need to encourage people to use the correct face masks and use them correctly as well. I just wanted to weigh in on a point that I think was also maybe one of the questions that I think was from Mr. Kizito Tentani about the need for the new administration also to own up to the fact that perhaps some of the messaging that downplayed the seriousness of COVID-19 was on the campaign trail, and usually mostly from the then opposition and now the people that are in power in office at the moment. I think there were some unfortunate messages that it's not enough now for just the administration to highlight the importance of fighting COVID-19, but I think it is also equally important for them to also acknowledge some of the mistakes and the miscommunication that was made on the campaign trail. So I agree with you, entirely, Mr. Tentan out there, that I think in this renewed focus on COVID-19, I think we also needed to acknowledge the mistakes that have been made so that we avoid them. But as Henry pointed out, maybe also we needed, I think, clarity on the politics to enable us to now mount an effective campaign on COVID-19. I find it actually, to be perfectly honest, rather unfortunate that up to now we still don't have a Minister of Health, even if the government has clearly, the president has highlighted the importance of fighting COVID-19. I personally would have expected that at a minimum, yes, they appointed 2-3 ministers last week, but one of them should have been a Minister of Health, and one hopes that this is something that the government, I think, is seriously looking at, so we can have political leadership in the fight against COVID-19 as well.
Thank you. I'm going to end with just one last question that had come in, and that was from Karonga, and it was, I think, an interesting and important question where they're asking if, I'll read it out loud to you. I've observed that there's a problem amongst faith groups here in Karonga. They look at COVID as the signs of the coming of Jesus Christ. As such, they treat COVID as normal. I feel this contributes to the widespread of the disease. We had a case here in my church, the Seventh-day Adventist Church, when the first COVID case was declared at Karonga Boma. Our church had to declare lockdown for 2 weeks. This brought division amongst the members who were abiding to the church lockdown, who were viewed as having weak faith. This is, of course, something that's not only, I think, an issue in Malawi, but it's an issue in my home country of the U.S. as well. So, how do we reconcile and how to deal with these issues of kind of faith when it might come in conflict with kind of what we might think of as health science?
I think it's a very good. I can say something, and Boniface, you can come in. I think you're right. I think this is not the first instance I've heard of sort of church members or church communities being resistant to the issue of COVID and things that can be done. I wonder whether partly, I mean, maybe that's a unique situation in Karonga, that it's people link it also sort of end of the world kind of situations, but also maybe a more practical consideration that limiting the number of people who can come to churches or locking down also means a reduction maybe in the income and coffers of the church. So maybe there are those sorts of considerations that drive some of the attitudes around responses to COVID. However, I think the government probably should have some kind of meeting or discussion with religious leaders. I don't know if anything like that's been done yet, but to really just have an honest conversation with them that, look, there is nothing apocalyptic about COVID-19. It is just the health situation that is affecting people, and that the religious institutions really can play a role in this within their own communities. I saw from your survey results that, and maybe not surprisingly, given some of these reactions, that people had a low level of trust in faith-based leaders. So I think perhaps, a serious conversation with them on their role in this, because they are key figures within their communities, and people may listen to them or not. So I think really just talking through some of the things that could be done and the ways that they can help to minimize the spread of this disease, I think is important. Thanks.
Yeah, I think you've really touched on all the key points there. I think religious leaders certainly have an important role to play in the process, both in terms of even sensitizing their members about the dangers of COVID-19, because they are an important and powerful voice in our communities. And I think it's important that the religious leaders should prioritize the life, safety, and security of their members, rather than thinking about the religious collections that they get from them. Because if all their members end up either sick or indeed some of them dying out, then there will be no people to attend religious services. But I think the responsibility should also be on the ordinary people themselves. I'm aware of a church within Zomba, where I am based, where at some point the church tried to close church. They closed, actually, at some point. They closed churches, and then there was so much pressure from the membership to say, no, we want you to start gathering again. So there is that kind of fatalism amongst Malawians. And yes, we pride ourselves in being very religious and very spiritual, but we don't have to hasten, I think, our journey to see the Almighty, so to speak. I think it's important that we use the intelligence that we've been given to protect ourselves, and that includes not putting our lives at risk. The irony is that I think earlier in May, if I recall, there were a number of churches that did close. I know the Episcopal Conference of Malawi for the Catholic Church, for instance, issued a circular at the time to say, okay, no more religious gatherings. But now religious gatherings have since restarted, and yet the number of cases has been going up so significantly in recent times that if ever there was a time to even think of closing religious gatherings, maybe now that is the time. So it does require, I think, both religious leaders and their members, I think, to think seriously about this pandemic, because it is a pandemic like no other we have seen in the past.
Thank you. And there's one more question, but I think we'll have to answer that on. We're a little bit over time. I want to thank you, Wezi, and of course, Bonnie and Henry and Absentia for joining us, and for all the participants for joining us and chiming in. And hoping that none of us, what did you say, hasten the journey too quickly, so that we all stay safe, and we'll see you again. Thank you so much.